A very warm welcome to our Facebook live session, Healthy Living with Watsons, brought to you, of course, by Abbott. And today is going to be a very exciting day, as I am pretty excited because we would be having not one but two speakers to be sharing with us whatever information that those of you who are actually tuning in, if you have got questions, you would like to actually have more clarity on the topics that we're going to be discussing today, then be sure to actually click onto the like button and, of course, drop us a comment for those of you who have just joined in. So today, as a starter, we are going to be covering two different topics. We would obviously be starting off with one, which I think a lot of us will be very interested to actually know. It's about kidney stones, gout. And of course, for those of you who don't really know much about uric acid, this will be the best time for you to also drop us your comments, because my very first speaker here today, of course, is someone you have probably read his articles or probably heard him, very often on a lot of different media platforms. So it gives me great pleasure because I have with me Dr. Warren Low. How are you doing, Dr. Warren?
Well, I'm fine. Thank you very much, Celisa.
All right, so thank you so much for actually joining us here today, because today we will be spending the next 45 minutes having a better understanding of, as we mentioned, gout, uric acid, as well as kidney stones.
Absolutely.
All right, so before we actually get into the whole, first topic of the topic and the questions, I actually would like to know, how have you been spending the whole, pandemic period? Because we do know you're still very active, and you also wrote an article in June.
Yeah, that's right. So I did write an article about the COVID and also the infertility.
All right.
But as you know, that the COVID is still a pandemic thing,
Okay.
and then obviously it's affecting everybody. So we physicians are actually not spared as well.
All right.
So I think that many people who are actually getting admitted, going for surgery, they need to be screened for COVID. So there's add on a lot of, things that we are completely not prepared for.
I see.
Yeah. But
All right.
fortunately, we are dealing with it quite well.
Okay, that's actually very nice to hear.
Yeah.
And I think you've always been very active here as far as the interviews are concerned, and even, with whatever articles that we've been reading. So, of course, today I think this will be a very informative session. And I would actually like to start off with my very first question about uric acid, kidney stones, and gout. Are there any similarities? What exactly, how is it actually formed?
Well, kidney stones, gout, as well as uric acid, they are basically closely related. I would say that they are literally just interconnected. The reason is because, most of us do not know how uric acid is formed. But uric acid essentially is a metabolic, a breakdown product of the purine. And the purine literally just come from what we consumed on a daily basis. For example, it can come from red meat, beef, lamb. It can come from your peanuts. It can also come from the beans. So there are pretty much quite a lot of things that we do not know, that ultimately the end product is going to be uric acid. So once the uric acid is formed, ideally it should be dissolved in the blood. But sometimes it does actually form crystals, and that can actually accumulate in the joint that give us the arthritis. That is what we call gout. And also it can also form stones in the kidney.
All right.
Yeah.
Okay. So that is actually quite a good explanation. And I think as much as, a lot of us, we know, some of them, we're very much into our diet and what we consume, because we are always after the nutrients without actually realizing these other stuff that are actually causing uric acid, right? So
Yes.
this actually leads me to my second question, which is, which are the type of people who are actually at a higher risk? Do we actually look at a certain ethnic group, an age, or what is it like?
Well, certainly. I think the epidemiology part of it, we
Alright.
do find out that certain races are actually having a higher prevalence as compared to the certain races. For example, if you were to talk about people from Pakistan, the incidence of having a high uric acid is probably amounting to about 28%, whereas in Israel it's probably about 22%. In America it's probably about 8 to 10%, and Malaysia stands somewhere in between, I would say.
In between?
That's right.
All right,
So it's
okay.
probably about 10 to 15% thereabout.
Okay, but
Yeah.
I also think it's the awareness also that also plays a big role,
Absolutely.
right? I think a lot of people, as much as you can identify it, but whether you take steps to prevent it or to even, go forward with treatments, that is the second part of things,
Yes.
right? Okay, so now that we are actually talking about this tree, yeah, especially gout and kidney stones, I'm actually going to go over to uric acid. We want to really just dissect and also see what exactly is uric acid and how do people usually get it? But of course, as we are actually having this discussion, be sure to also drop us your comments. If, let's say, a few of you here, you want more clarity, you are unaware, or maybe you want Dr. Warren to also explain it better for you, well, feel free to drop us your comments. So, Dr. Warren, so why don't you walk us through what exactly is uric acid?
Well, the uric acid, as what I mentioned earlier on, is a breakdown product from the purine.
All right.
Can come from our diet. It can also be found in certain conditions, for example, thyroid problems. So those patients who have an underactive thyroid and those patients who are on certain medications, for example, the diuretics, and then even certain tumors, we call that as the tumor lysis syndrome, can produce excessive uric acid that can be stored in the body. So there are many, many reasons for that as well. Yeah.
Okay. So, of course, the diet is one,
Yep.
all right? And then we also have the different age groups, because I think a lot of people, sometimes when it comes to activities, when it comes to how their daily routine is like, they tend to be having different tastes after a certain age as well.
Absolutely.
Is it safe for me to say that?
Yes.
Right?
Because
Okay.
we found out that as compared to men, women actually have a less incidence of having this uric acid problem as compared to men. So let's walk through the age part of it, since you mentioned the age.
All right.
So anybody who's younger than 65 years old,
Okay.
I think that the ratio for men to women stands for about 4:1. But when it reaches about 65 years and above, it actually goes down to about 3:1. So, sometimes there are some differences in terms of men and women and also the age.
Okay, all
Yeah.
right. So now that we can actually understand, yeah, it comes back to the age as well, and then the diet most importantly. But would you actually lean more towards the diet part to say that, yes, I think that one would probably save a lot of people the trouble of even getting your uric acid being super high. Can
Yeah,
we
I
actually
think-
say that?
Absolutely, because I think that is really something that you can do.
All right.
For example, like if you know that what are the diets that actually produce very high purine,
Okay.
like red meat, like internal organs like livers and gizzards and all these stuff.
Okay.
And also the nutty stuff, walnut, cashew nut, groundnut, peanuts, the beans, and even tea. So
Okay.
all these things actually produce very high uric acid in the body.
Okay.
Yeah.
So, doctor, you mentioned a couple of times that if your uric acid is very high. So, what exactly are the numbers? Is it, when do you actually know exactly when you need to go in for treatment?
Yeah, there are many units for that. So
Okay.
the simplest way is to remember, for men, anything which is less than 7 milligram per deciliter is considered normal. For women, is 6 milligram per deciliter, whereas for children, it's about 5 milligram per deciliter. So anything above that would be considered high.
All right, okay. So I know when it comes to the starter, we are looking at the diet, the different things also that comes about, as how you mentioned your age and whatnot. So when it comes to the treatments, usually being a doctor, of course, you're very much giving a lot of advice about that. What are the kind of treatments that you would usually suggest?
I think if the patient were to found to have this high uric acid,
Okay.
first of all, we want to find out whether they present to us with either gout
Okay.
or urinary stones. So obviously the gout and also urinary stones, they all have the different presentation. So the patient present to us with very painful, swollen big toes, for example. That is a classic symptoms of gout.
Gout.
So in that case, we may have to treat them with either medication, or in certain times, we may have to actually explore and see whether there are surgical intervention needed for this or not.
All right, okay.
Yeah.
So now that we actually have a good understanding of how uric acid is, we're going to hold on before we actually go into gout, all right? And of course, I'm very happy because we're actually looking at a couple of questions. So for those of you who have actually just joined us, we have got Dr. Warren over here. If you would like us to answer any questions, just drop us a comment. So as far as our questions are concerned, well, we'll be reading it out as we actually go. And next up would, of course, be about gout. Yeah, so I think gout is also, we hear a lot of people mentioning about it. We are aware that a lot of people also suffer from it. But before we go into gout, let's actually take this question, doctor. So this is actually from Sindhu Subramaniam. Hello, doctor. I have a question. Do all gout cases need to be treated with medication or can be treated with strict diets?
I think
Good
you-
question.
Yeah, in fact, I think it's a very good question because it really all boils down to how high the level is and also how significant is the symptom. So if the patient does present with something like a severe, very swollen, painful joint, then with a very high uric acid, then obviously we know that we got to treat him with medication rather than diet. So if it's just marginal with intermittently slight symptoms, then perhaps you can still go on a strict diet. But really, all boils down to the level of the uric acid as well.
All right, okay.
Yeah.
I think this one is safe for us to say, yeah, as much as we have got treatments and all of it, it still goes back home to, yes, you may be treated in the best of the best, but what you consume also, you're also helping yourself out quite a bit.
Absolutely.
Right? Okay, so anyone else here who's got more questions for us? And we're going to move forward now that we're done with uric acid. We are still going to continue on this whole topic, and this actually leads me to my next question, which we often hear people using the word gout. So when it comes to gout, I know some people are familiar, but what are the symptoms of gout?
Well, I think the gout usually, those patients will present with a severe, painful, swollen joint, more so in the toe. But of course, it can happen in other parts as well. For example, the knee joint, the ankles. So all these things, they are all due to because the urate crystals is actually forming inside these joints. And that's the reason why they have all the symptoms of painful arthritis. Now, if the patient were to present with something very acutely, most of the time we got to give, as I say, painkiller maybe, and probably with some steroids. And of course, the medication to bring down the uric acid. And that will actually control the symptom to a certain extent. But again, if the symptoms recur, then we may have to consider the maintenance medication just to ensure that the patient doesn't suffer from any recurrence of the symptoms.
Okay, all right. So now that we actually understand what exactly gout is, so why does it actually happen? Why? As in, is it also just, completely because of the diet, or what exactly?
Well, as I mentioned earlier on, some patients with the thyroid issues, some patients on certain medications, so some are genetically linked. So all these people actually have a higher, incidence of getting this gout problem. So if you have a very strong family history, for example, genetically linked, then you probably should be aware that, if you suffer from the symptoms very similar to gout, then please seek help, because for all you know, you could be really suffering from gout.
All right, okay. So when we're talking just about gout, I know for a fact that you're very well versed with this, because we've actually read a couple of your articles. We've also heard a lot of your different talks. So why don't you share with us, like based on personal experience, if you do have maybe a very severe case of gout, your whole expertise, why don't you share with us in that?
I think as a urologist, most patients come to us with a urinary stone problem.
Okay.
So it's almost like an indirectly we found that the patient have a very high uric acid, and if you were to to question them a little bit more, you will find out that they actually suffer from maybe intermittent gouty arthritis. Now, without paying much of an attention to it.
Okay.
So now, inevitably, you know that if you have to treat the stones, you do not want the stones to recur. So the best thing is to get down to the bottom of it, and that is to treat the uric acid.
Okay. So very nicely said. It is in a way, correlated, yeah?
Yes.
All right, okay. So Healthy Living with Watsons brought to you by Abbott. We are still here with Dr. Warren, and of course we're very happy to read any questions, any comments, just drop it over. And this one I would like to pull out is from Jin Ho. Is there a correlation between gout and obesity?
Yeah, we actually found out that those patients with a high uric acid somehow are linked to other problems, like, for example, the hypertension, diabetes, fatty liver, and even obesity. In fact, obesity, psoriasis, and there are a lot of other reasons that actually causes high uric acid. Yes, the answer is yes.
Yes, yeah? All right, okay. So we have the next question from Miss Vivian Tay. May I clarify if doctor mentioned tea is one of the diet that causes gout?
Well, we must understand that the tea actually contained a very high oxalate. And then, for us who actually, treat stones all the time, and then if you have a patient that actually like to consume tea so much, most of the time they end up with stones. So ultimately, when we drill further back, we will find out that whether this patient actually have a high uric acid, it could be actually linked together.
I see. Okay, honestly, when you said tea, the first thing I was thinking is that I absolutely love tea. And yeah, but it's actually a very good understanding and realization also, as much as we are consuming it, moderation, that would be the key, right? Okay, so we have got the next question here from Aina Nazalina. Any age can get gout? I mean, from what age?
Well, there's no age because, as I mentioned to you, the uric acid for children is about 5 milligrams per deciliter or less. So we do have small kids that actually present to us with gouty arthritis as well. So it's not uncommon.
Okay.
So it is not necessary that it's a disease of the adult.
All right.
Yeah.
I think also kids, because generally, as much as a lot of parents these days, they're very concerned about what their kids are actually consuming, but still the freedom to eat whatever, the kid actually wishes, it's still going to be there. It's something very difficult to actually stop among kids, right?
That's
in a
right.
way. All right. So anyone else here, any other comments, do let us know. All right. And okay, we do have the next one from Aina Nazalina. Why gout patients should not eat seafood? Good question.
Well, we know that the seafood, just like red meat, actually contained high purine. So you know that the uric acid is nothing but a metabolic breakdown product of the purine, and that's the reason why they are not encouraged.
All right.
Yeah.
Okay, so you know what I really like about this session? It feels like we are getting a very good breakdown altogether, yeah, of what we can consume, what we should not consume. One thing I know for a fact is that when I'm going back home, I'm going to be thinking at every single, every time I look at seafood or tea, I'm definitely going to be thinking of you, Dr. Warren. All right, so anyone else here, you've got any other, questions you would like to clarify? And these are the kind of questions where as much as, a person may read it up, as much as you may try to educate yourself on your own, it's much better for you to get your insight from a doctor, like Dr.
Absolutely.
Warren, of course. So do let us know. We are still going to be with you because we have got another 25 more minutes. And I'm actually going to go over to the last part, yeah, because we're going to be covering uric acid, we're going to be covering gout. And of course, most importantly, I think this one is also a major concern. A lot of people are very, worried about this. What are the causes of kidney stones?
Well, kidney stones form because the urine get oversaturated with the salt in the body. And then, of course, there are certain conditions whereby there's lacking of inhibitors such as citrate, and that actually results in stone. So there are many, many types of stones. So we have calcium stones, calcium oxalate, calcium phosphate, and we do get uric acid stones and infective stone as well. So as I told you before that, the uric acid is closely linked to the urinary stone formation. So for those patients who have high uric acid, and then if you could really control your diet, for all you know, you can actually control the recurrence of the stone, and that I think is the key point.
Okay,
Yeah.
all right. So, okay, very clear on how the stones are actually, formed. I know this is going to be another question where a lot of people would think that, does it actually disappear on its own if you don't really treat it? Is there a way for you to go about it by taking it into your own hands? Is there?
Well, I think that a lot of them actually have stones without themselves knowing, because if we're looking at a very, very tiny stone and depositing in the kidney, the patient could very well be unknown about these things. But the problem is that if you're talking about stones, which is about 3 millimeter or less, from the literature, about 97% can actually come out on its own. So you probably do not aware that you actually have stones that come and go all the time.
All
So
right.
yes, sometimes you don't really need to do anything when it comes to very small stone. But when it comes to stones, which is a little bit bigger, so that's why the management of stone actually comes about when we talk about the size of the stone, when we talk about the location of the stones, and also the consistency of the stone. So bigger stones may need to have some form of an intervention.
All right.
Now, in terms of medication, so a lot of people actually ask me, is there any medication that can be used to treat the urinary stones? I think in broad, we actually have two types of medication. One is what we call medical expulsive therapy. So if you have a stones which is originated obviously from the kidney and being propelled down to the ureter, so you can certainly sort of like give some medication to dilate the ureter. So
Alright.
if I may just show you
Yes,
a
of
model
course.
here. So you know that the kidney stones starts from here. So if it get propelled down to the ureter, if you
Alright.
can give some medication to kind of like dilate the ureter, which is the urinary tube, the stones, once it pass the ureter and enter the bladder, it's going to come out in no time. So this is what we call medical expulsive therapy. It works for very fine stone. And also there's another one which is medical dissolution therapy. And this is where the medication for uric acid comes about. As you know, some of the stones are actually uric acid
All right.
formed by the uric acid. So if you can give certain medication to bring down the level of the uric acid, for all that you know, the stone could have just dissolved on its own without you doing anything. Yeah, so it's important to know.
Okay.
And then obviously, if the medication doesn't work, and then the next option is obviously surgical intervention, where I
Okay.
think everybody will be worried about.
Yeah, worried about, because being Malaysians, a lot of us nowadays, I think a lot of people can relate to this. We have that habit of wanting to read and Google things
Yes.
off the internet and try to treat ourselves with whatever remedies that we can find at home, which can be quite dangerous at times, right?
Absolutely.
And also the understanding is that it's like you said, some people say that if the stones are too small, you're just going to take it as, it just goes off on its own. But when exactly is it too small and when exactly is it too large? That's also another thing which we all should be very concerned about, right, Doctor?
Yes.
Okay, so in your experience, has there been anyone walking in with, that kind of, I would really want this to be very relatable to a lot of people, where they would probably start off trying to take it into their own hands and then gradually going into a larger one. Is that a very, very common thing that happens?
Yeah, I think I would say so.
All right.
I think that is more common in those people who have had previous stone formation before and maybe who would have had some surgical intervention. And then they know that they may have a recurrence of stone. So I think the important thing is that rather than treating it yourself, I think seek help from us, because small stone can certainly come out on its own even without you doing anything. But the bigger stones, I think it's better for us to, deal with it. So seek help from the proper channel. For example, the physician will be important. I think more importantly, not all patients with stones are aware that they actually have stones. Some stones are actually picked up from the medical checkup. So it's important for us to actually go for a routine medical checkup. And if you were to find out you have smaller stones, I think it's better for us to deal with it earlier rather than it become really, really huge. And then it will be like, surgical intervention straight away.
Yep. And I think the pain that comes together with kidney stones is also quite,
It's
severe.
excruciating. A lot of patients actually come in stretcher to the emergency because of this severe pain.
So the size of it, putting that aside, imagine
Yeah.
the pain even if you're talking of, smaller ones. And I'm sure a lot of you guys who are actually watching us, you could probably relate to it if you probably, had been a patient or had a family member going through it. I still have got memories of, friends going through that, and the pain was really, really horrendous, yeah? Okay, so we have got more questions, and this one is from Jennifer Darcy. Normally, gout takes place at joint area. May I know which area is it usually prone to? Good question.
Yeah, usually it's more towards the big joint, like the toes. Okay, so the big toes.
The toes.
That's right.
All right.
The classic one.
Okay, and that is, the toes is the classic one, and the other.
I think the other joints, such as the knee joints, the ankles, they are all not spared as well. And more
Okay.
importantly, sometimes you do get something called a tophi, which is a urate or a uric acid crystals that can actually be deposited over the skin, so underneath the skin. So in that way, the patient can experience something like really, really huge, like nodule-like thing over the joints. I think that could be very sightly, and not to mention it's very painful as well.
Very painful.
Yeah.
Okay, all right. And the next question we actually have is from Kwa Suk Yen. Can gout attack be triggered by extreme exercise?
Well, I think that, not that I know of.
Okay. I love questions like this where, the amount of thought that is actually going into the kind of workouts, the kind of exercise as well.
Yeah.
It's a good concern to have,
Yeah.
but from your experience, you've never heard anything.
I think what could be related is that if you do have history of gout and you know that you have this painful joint, I know if you were to sort of like exercise to the extreme end, so what's going to happen is that you're going to trigger that kind of a pain, swelling, So I suppose it's actually related.
Okay,
Yeah.
it's possible,
It
but
is
maybe
possible.
it's not, directly going to
yeah,
be from
yeah.
that. All right. Okay, so our next question, we still have more, and we're very happy to actually read all of your comments. So do take your time because we still have another 20 minutes approximately. So my next question is from Angeline Joseph. Can gout be cured, or maybe drugs to lessen the gout symptoms?
Well, the gout can certainly be cured, and that's the reason why we have medications to treat them. So
Alright.
during the acute attack, we can actually give them the non-steroidal, drugs, the NSAID, and then of course we can also give them the colchicine, and also we can give them steroids to actually reduce the inflammation. And then for those patients who actually have a high uric acid but never seems to have any symptoms but need to actually maintain the uric acid to an acceptable level, we can certainly give them maintenance drugs.
Okay,
Yeah,
all
so
right.
it's a different group of drugs because this different group of drugs actually have two functions. One is to inhibit the uric acid formation. The other one is to promote the excretion of uric acid from the body.
All right, okay. So, of course, it is whatever treatments out there. I think the bottom line is that always consult your doctor. and try to, find ways without trying to hold on and wait for things to actually get worse, right?
That's right.
I think it's safe for us to actually do that. As Malaysians, we become very ambitious. We are very curious, and we always end up reading and taking things into our own hands, right? So, okay, Angeline, I hope that Doctor has actually answered your question. And now comes the next question, Awin Azza. Hi, Doctor. I heard that drinking cranberry juice can reduce uric acid. Is that true?
Well, I think that the cranberry juice essentially is mainly used, for recurrent urinary tract infection.
Okay.
So we usually use the cranberry juice it's kind of like a preventive measure for those women who suffer from urinary tract infection. So going back to the question.
Yeah. Which is cranberry juice,
Cranberry
yeah?
juice. So if you were to take a long-term cranberry juice, it actually helps you to fend off the infection, because some women actually have it all the time.
Okay.
Yeah.
All right. So now that we're actually talking about cranberry juice, this is going to be the next question, which I think a lot of us also are very curious. Do you actually have like a diet recommendation for people suffering from high uric acid? If at all, if you were to plan it out in a very simple way, a diet recommendation would be great.
I think I would say that those diet that actually contain very high purine content, for example, red meat, internal organs, the nutty stuff, the tea, the beans, I think it's best try to avoid if you do have history of gout and also urinary stones, which is due to the high uric acid.
Okay.
But I think every single one of us should remember that taking everything in moderation is important. It doesn't mean that if you like certain things that you should actually take it more. Yeah.
Okay, so the key here, of course, is moderation,
Yes.
but avoiding those lists, that you've actually mentioned also does us a favor in a way, yeah?
Yes.
All right, so cranberry juice, now at least we have a good understanding of that. And the next comment that we have is from Charles Leong. Is it true that high consumption of beans will lead to uric acid? Yep,
Definitely.
definitely.
Yeah.
All right, so Doctor has answered that question. And Sindhu Subramaniam, his comment is, good day, doctor. I've read in medical journal about TOPI. Can I know what's that and how is it related?
Basically, it's a uric acid crystals
Okay.
that is deposited underneath the skin.
Skin,
Yeah,
alright.
so I think the picture just now actually showed up that you can have patients with a lot of nodules like thing around the joints, and that could be just tophi, and it's related to the uric acid.
Okay, all
Yes.
right. So Tawfai, and that is Sindhu Subramaniam's question. So we still have Dr. Warren here with us in the next 15 minutes. And if you are, probably having your dinner or any of that, make sure you join us, because Healthy Living with Watsons is brought to you together with Abbott. And we still have got quite a number of questions, because from this whole understanding that I have, I think gout, uric acid and kidney stones, a lot of people are always wanting to find out, but they're not very familiar. It's one of those things where you may have it and you still don't really know how to go about it, right? Okay, so this also leads me now to the next question. It's the urinary alkalinizer, which could actually help. Does it actually help? Do you actually think it does?
Well, I think the urine alkalinizer essentially helps in a few ways.
Right.
For example, it helps you actually, because you know that this is an alkalinizer, so it kind of like neutralizes uric acid, so that is one good use of it. And then for those patients who actually have the uric acid stones, for example, you know that the urine alkalinizer, some of them actually do have some citrate content of it. Citrate is an inhibitor for stone formation, so in that way it also helps out as well. Urinizer also can be used for recurrent urinary tract infection, because it kind of like somehow like flushing out all those, the infective stuff. So I think urine alkalinizer is useful in that way.
All right, so it's quite powerful, we can actually consider
would
and
say
conclude.
so, yeah.
Okay, all right. And anyone else here, any other questions that you have, well, let us know. We only have, I think, approximately 10 more minutes. And what I really like about this session is that we at least have a good understanding of the kind of diet, the kind of foods that we could probably avoid,
That's
or
right.
to actually help. So since you actually gave us a good example of how the stuff that we could probably avoid, does that also apply, let's say, for kids? Because kids are also getting these sort of symptoms. What would be your suggestion for that? Since we're quite familiar with what the adults would do, what about kids?
I think that you can't control the diet for kids, can you?
You can try. If you actually go past that and you can actually control your kids to actually have a strict diet, well, I would love to actually hear that as well. But what do you think would be best, let's say, for probably parents who are actually looking into, their kids and trying to avoid it? Because perhaps I think a lot of us here maybe have got a family history of, our parents, elderly parents actually seeing that. So to actually start your kids from young, I think what would your suggestion actually be?
I think that is just like an adult, and if you have a strong family history of gout, and if it's genetically linked, so what you want to do is that start from young. So tell them that there are some diet that actually can contribute to high uric acid. Perhaps it's actually good to avoid them, or I think take a very healthy diet. Take everything in moderation is the key.
Okay, all right. Thank you, doctor. And now we still have got more questions. I am reading it from, the next one is from Adelia Felicia Gomez Jebron. What are the early signs of symptoms of gout that we need to be aware of?
Well, I think importantly, we know that the gout is nothing but some form of a painful arthritis.
Okay.
Okay. So early signs will be if you start to get this joint pain and all, so don't brush it off as something which is can be treated easily with painkiller, because you want to know whether this is due to the high uric acid. For all you know, it could be a gout. So if it is gout, you can be so easily treated by just medication to reduce the uric acid level. So you do not really want to bang on the painkiller all the time, because ultimately too much of painkiller is going to do your kidney no good, I would say.
Yeah, very, very true.
Yeah.
In fact, I think it's also, if we actually look back into how our daily lives are, sometimes you could have a certain pain that keeps coming back, and we would always assume that, okay, it will be fine tomorrow. And then you would just assume if I were to take this vitamins, it's going to get better. It starts off with minor little pains. It could be on your hands, it could be on your feet, and that actually leads up to a lot, right?
That's right.
So as a starter, try to always make sure that if you can get yourself, checked, go over, visit your doctor. That's the safest thing you could possibly do, right?
Absolutely.
Okay, so I still have got another question from Jennifer Darcy. Doctor, I have a question. How to differentiate between osteoarthritis and gout attack, right?
Well, I think the simple answer to that is probably just to get your uric acid checked and see.
Okay.
Yeah, and then that is the first way to start. And of course, other things like, for example, X-ray is important. And ultimately, the person that really treats the osteoarthritis is actually an orthopedic surgeon. So it may be worthwhile getting some help from them as well.
Okay.
Yeah.
All right. So that is the question from Jennifer Darcy. And next up is Jin Chong. Does high consumption of malt drinks causes the problems? Gout, uric acid, and stones. What about malt drinks?
Yes.
Yes?
It is, yeah. That includes the alcohol as well.
All right,
So
okay.
why,
I'm
we
sure a
always
lot of
advise
people
the
won't be
patient
too
that
happy to
reduce
hear
the
that. Yeah.
consumption of
Okay, so
alcohol,
malt
yeah.
drinks, yeah. I think a lot of people also generally being very, Malaysians, we are very used to how we will walk into a store and then if, let's say, you're thirsty, you would go for a malt drink as compared to water, mineral water. It's quite a practice I see also among a lot of, and they start your kids young with that, yeah?
Yes.
Right? Okay, so we still are taking in more questions. If you have just joined us, this is Healthy Living with Watsons. And of course, this is made possible with Abbott. And today we have got a very interesting topic, like I've mentioned. It's about kidney stones, uric acid, as well as gout, yeah? So if you would like to ask any questions, go ahead, drop us your comments, because Dr. Warren, of course, is very well versed when it comes to this topic. And let's say, for example, if you are seeing slight symptoms, make sure you try to, do something. Do yourself a favor. Go and get yourself checked in order for it to not, go to a point, like you said, it's really painful on top of that.
Absolutely. I think that what I would like to emphasize on is that a lot of people are just focusing on the uric acid causing the gouty arthritis. But what is more important is that the one that follows is actually urinary stones. So if you do get stones, please have your uric acid checked as well, because it can, it is treatable. And then, if you have stones and then you have to deal with it with medications or some surgical intervention, and you do not really want it to come back again. So the only way is to find out, to get down to the root of the problem, and that is really just to, find out whether the uric acid is a contributor to that.
All right.
Yeah.
Okay, so we have got another question from Tick H. Lim. Hi, Dr. Warren. Is it true that high calcium diet, like milk tea and examples of those, might contribute to the occurrence of gout?
Well, I think that the important thing to find out is that what is the content of the milk tea. So as I told you before that, this is actually one of the component that actually will form, high uric acid. So ultimately, I think it's best to actually avoid it. I mean, of course, taking it in moderation is fine, but do not excessively consume it.
All right. I think I must say, yeah, we have to really still remember anything in moderation would still keep you very safe,
Yeah, that's
away
right.
from that, right? Okay, now comes the next question from Ryan Tong. Doctor, are there consumption of certain foods that causes kidney stone formation? Right, I think you have answered this earlier about
Yes.
the type of food, and we can already see a pattern here. A lot of people are very concerned with the diet, right?
Yeah.
Especially for people who you are consuming it in a way that you're looking out for all the nutrients without realizing you are also indirectly causing that, right? So now we have got another question from Yasmin Harun Jaffa. Does soy in nutritional drinks safe for uric acid patients? Soy.
Well, as I mentioned, soil bean, any form of a bean, and
Any
nuts,
form of a bean. Okay.
and nuts, they're actually, I would say, culprit for uric acid, unfortunately. So
Okay.
I think that I know that there are many vegetarians there. So if you were to take something like a soil product, it's good, but do be mindful about the occurrence of high uric acid, because ultimately they're going to give you gout and also the urinary stone, and that is really not what you want.
Okay. You know, every single time you go into Starbucks and then you think about switching it to soy milk, I am definitely going to be thinking about your words here today. Yeah, because, this is the assumption that we always have. If you're actually avoiding your dairy products and then you're switching over to soil and, different nuts, almond milk and stuff like that,
Yeah.
that's also another reason. Yeah.
Absolutely.
All right. So the next question is from Sharon Lim. Any food to avoid if patient with kidney stones? Okay, back again. Anything else additionally from what you have already answered, perhaps?
I think there are many people who is not aware that taking high dose of vitamin C can also contribute to stone formation. So, I know that the vitamin C is good to increase our immunity system. But the thing is that if you are actually taking high dose of vitamin C, it's actually one of the culprit to form stone as well. So yes, uric acid is one of the contributor for stone formation, but there are also other things like calcium. So when we talk about the calcium, I often get a lot of questions. Should I be avoiding taking calcium? What about all those calcium products, for example, the milk? So should I be avoiding that? The answer is that no, it's not necessary, because calcium is good for osteoporosis. So there's no necessity to deliberately avoid taking the calcium diet. So calcium is not something that we would actually say that you should avoid. I think that is good, but take everything in moderation.
In moderation. Okay. So quite important, yeah. As much as
Yes.
vitamin consumption,
Yes.
it also, in a
Yes.
way, yeah.
Many people are also not aware that some HIV medications, like for example, indinavir, does cause stone formation as well. So there are many reasons for stone. So uric acid happens to be one of them, but there are also other things like, for example, those patients who have hyperparathyroid disease. Those patients who are on certain medication. There are certain medications that can actually promote stone formation as well.
Okay.
Yeah.
All right. Very important note. And the next question is from Alicia Ong. Hi, doctor. Does taking calcium supplements increase the risk of kidney stones? Yep, I think that
We
was...
just answered
We've
that.
just answered your question, in fact, yeah. Vitamin C, calcium, it actually does, yeah.
Yes.
If at all, if you're not very, sure of how much you're actually consuming, time for you to actually look into that as well.
That's right.
All right. Next one is Andy. What is the dosage of urinary alkaline I can consume for uric acid problem? Good question.
Well, I think that for patients with high uric acid, that we need the urine alkalinizer to kind of like neutralize it. But most of the urine alkalinizer come in the form of a salt, for example, sodium bicarbonate.
Okay.
So if you were to take for a long term high salt product like this, so it's going to end up with hypertension. So that's not what you want. So I think that if you were to take, for example, if they are coming in a sachet form, 1 packet a day or even 2 packets a day is fine.
Okay.
But if you were to consider taking it on a long-term basis, make sure that you don't go overboard.
Okay.
Yeah.
All right. I think most of the time it's taking also correct instructions from your doctor and never try
Absolutely.
to take it into your own hands, yeah? Let's just be
Yes.
very clear on that,
Yes.
right? Okay, so we also have the next question, and this is from Sindhu Subramaniam. Once again, hello doctor, is there any side effects of gout medications? And also, is there any serious complication of gout? complications?
I think the side effect for medications, I think all of them have side effects, I would say. So I think it's very important to get a proper instruction from the doctor. It depends on what medication that you're taking, because it can come in the form of steroids, painkiller, all these things. So they all have some form of a side effect, most likely gastrointestinal side effect. So any serious complications of the gout, I would say that some of them may end up with tophi, as I mentioned to you earlier on. Joint and also the tissue deformities can also occur because it can cause long-lasting damage. And of course, if this patient is associated with high uric acid, was actually found to also contribute to hypertension, diabetes, so all these things are actually association factor. So it comes together with the gout as a package, I would say.
Okay,
Yeah.
as a package.
Yeah.
That's how, I mean, you've been completely honest, yeah? Complications can come about, especially with all these medications, but also, I think what was really important just now is like the vitamin C's and painkillers. These are the things where generally we are always going into and thinking, it's completely okay. It's vitamin C, right? It's a painkiller. It's just going to do you good in that few hours. And
Watch
yeah.
out for the kidney
Yeah,
damage.
exactly.
If you're on
Yeah. So I think abusing
painkiller.
it also, we need to also take a step back, yeah, when
That's
it
right.
comes to that. All right. Okay. So anyone else here, perhaps if you have got more questions, you could still drop us your comments. We'll be very happy to answer them. And today's discussion is about gout, kidney stones, uric acid, the three which I find it to be. A lot of people want to know more. We want more clarity, yeah? And it, like you've actually mentioned, it doesn't matter even if, let's say, you are having kids at home. It's also good for you to look into it as a starter, start them from young.
That's right.
All right, so doctor, we still have got a couple more minutes here with you, and to conclude this whole thing, so we can actually say the diet is very important, right? Avoid all of those foods that you have actually shared with us here on the session. And if at all, if you have got any different types of medications that you're taking, do it in moderation, whatever that you're doing on your own.
That's right.
Right? Is there anything else that you would like to add on as far as advice is concerned, or perhaps maybe the kind of patients that have been coming to you, you would like to add on?
I would say that adopt a healthy lifestyle,
Right.
And eat the balanced diet, eat everything in moderation, and please go for a medical checkup, because you never know. You can pick up something which is like you never know that it is actually always there.
All right.
So, for example, the stone. Yeah. So stone, sometimes it could be sitting there for a long time in the kidney without you realizing it. So it's best to deal with it early rather than late.
The prevention is always
Always
a
better than
lot
cure.
better than the cure,
That's
right?
right.
Very nicely said. All right. So, we still have got one last question. Do you think we can actually add on one last question for
Definitely.
this, right,
Yes.
doctor? Okay.
Yes.
So from Sharon Lim, hi doctor. If undergo operation for kidney stones, is kidney function? Will the kidney function be affected?
Well, I think that it depends on what type of operation that we do for the patient. For example, if you were looking at endoscopic surgery, let's say if I can use this model, and then if you have a stone which is sitting in here or in here in the kidney, and if you can use the endoscopic way of sort of like using this particular scope to go up there to actually tackle it with the laser, I think that would actually do very minimal damage to the kidney. But if you're looking at a very humongous stone sitting in the kidney, then you have to drill through the kidney to actually get access to the big stones and eventually fragment it with an ultrasonic or even laser, then obviously that particular part can get a little bit damaged. But most of the time, you know that the kidney share the function. This is 50%, this is 50%. So you end up with the right side having to about 20% of function, the other one will be 80% of function. So you know that it somehow can compensate back. And that's the reason why we can actually donate one kidney for kidney transplant.
Okay, all right. So I think that was a very good explanation of the kidney function, because a lot of us, like you said, yeah, giving of one, we always
Yeah.
have different types of assumptions. So Sharon Lim, I hope that you have gotten your very clear answer on that. All right, and I think we are actually running out of time. But before we actually bid farewell to you, is there any last words that you would like to share with your viewers, especially for those who have actually learned a lot in our session here for the last 45 minutes?
I think that when it comes to urologists, we often deal with stones. Yeah. So when it comes to stone, calcium stones, for example, or even the other type of stones like cystine, xanthine, or even the strobite stones, there's really nothing much that you can do about them. But uric acid stones happen to be something that you can actually avoid having by just checking on your uric acid, because you do not want the uric acid stones to pop up over and over again. As I mentioned earlier on, once a stone former is always a lifelong stone former. So be very mindful about the diet and also have a routine medical checkup. I think that would be the key.
All right, very nicely said, and of course, very, very solid advice as well. So, Dr. Warren, thank you so much for actually,
you,
spending so much of time answering all of the questions from our viewers here today. It has been a complete pleasure. Thank you once again, and
Thank
most
you.
importantly, I think the advice that you've actually shared here today, right? We should all bear in mind. So, thank you, Doctor.
Thank you.
All right. So, this actually sort of wraps up our first half of our session here today, and this was very informative because Dr. Warren has given us a very good breakdown of the kidney stones, uric acid, as well as gout. And now moving on into the second half of our session here. This, of course, is Healthy Living with Watsons, made possible by Abbott, and we would love to actually answer all of your questions. If you would like more clarity or you would want to have a better understanding of whatever symptoms that you're having, let us know in the comments